Every year, thousands of infectious disease experts come together on one conference floor.
Whether you're a student at the beginning of your career or a leading voice in your field.
This is an opportunity you just can't miss.
The IDWeek meeting is the best place to find the latest and greatest in infectious diseases research.
We're on the ground here in Los Angeles, California to bring you all the highlights.
The Infectious Diseases Society of America.
The Society for Healthcare Epidemiology of America.
The HIV Medicine Association.
The Pediatric Infectious Diseases Society.
And the Society of Infectious Disease Pharmacists.
We're here at IDWeek 2024.
And this is IDWeek TV.
Hi, I'm Melissa McCarty, your IDWeek TV host. We are so excited to be back. We'll be here all week long with exclusive interviews, inside looks, and highlights from this year's annual meeting. We've got a great show coming up for you today, diving into the hottest topics in ID.
I know I kind of felt a little bit embarrassed and shy when I first started, but the opportunity it's amazing. And the windows that it has opened for me in terms of networking and job growth is just unbelievable.
Callie Blake boasts an impressive 120,000 followers on TikTok. She's here to tell us how you can leverage your social media in your career.
Since COVID started in 2020, that's when we really started getting going with wastewater surveillance. And it's really blossomed in the last 4 years. Now the CDC's National Wastewater Surveillance System has expanded to over 1,500 sites and has a presence in 50 states and jurisdictions, so it's really grown.
From the California Department of Public Health, Alexander T.U. will discuss the future of wastewater surveillance in the U.S. Plus, we'll visit 4 groundbreaking HIV research groups making waves in clinical care, education, and even policy. We've got so much amazing content coming up today and all week long. To make sure you don't miss a second of it, you can keep watching IDWeek TV on screens around the Los Angeles Convention Center, in your room at select hotels, and on the IDWeek 2024 annual meeting website. You can find all of our episodes, segments, and film series features on the IDWeek TV 2024 YouTube playlist, and find selected segments and bonus content on social media. We are kicking off today's show with a conversation on what's new in HIV clinical care. Joining us now is Allison Agwu from Johns Hopkins University. Allison, welcome.
Thank you. It's a pleasure to be with you this morning.
Well, we appreciate the time. Now, I want to jump into your HIV research.
Yeah.
It seems as though there's a lot of emphasis on the impacts of young people. Tell me why that's so important.
Yeah, no, thank you for that. So young people, as you think about that, between the ages of 13 to 25 or so, they make up about 1 in 5 of people who continue to acquire HIV in the US. It's about 30,000 people every year. They have the highest rates of HIV acquisition, but also it's harder to get them sort of engaged in care, get them virally suppressed, which is the ultimate goal. So there is an important emphasis on getting that population reached and getting modalities of treatment to help them get to undetectable or to end the epidemic in that population.
Absolutely. Yeah. The goal is curing in children, is that right? The curing kids, tell me more about that.
Yeah, sure can. So certainly we're hearing more and more about cure research, and we've seen now, I think, our 7th adult patient who has had a bone marrow transplant or stem cell transplant where they've had long-term remission of their HIV. At this conference, I will be highlighting data that was presented at an earlier conference in the year on remission in children. We've heard about the Mississippi Baby, where there was a child who went on for a prolonged period of time off of antiretroviral therapy and who went on, ultimately rebounded. There's now more research in basically replicating that long-term remission in children. So 6 kids in a study getting to remission, and now 4 of those kids being beyond 48 weeks without any viral rebound. This is teaching us a lot about where we need to go for potential long-term remission towards cure in children. So exciting research presented at other conferences that I'll highlight today as well.
Yeah, potentially groundbreaking.
Groundbreaking research, actually.
Wonderful. Now, what would you say at this point is like the most profound idea or even innovation coming out of HIV clinical sciences?
Yeah, so I think number one, it is expanding our armamentarium of both treatment and prevention. So thinking beyond just having people take pills, thinking about how to expand how you give medicines to people. So that's injectable therapies, that's moving beyond therapies at all to broadly neutralize the antibodies and other things to hopefully get people to be virally suppressed if they're already positive, or to help them not even acquire HIV at all. Right? So you'll hear at this conference and other conferences before that have happened earlier, the injectables like lenacapavir or cabotegravir, just things that are coming to literally meet people where they are to hopefully get them to, be suppressed if they're not, if they're positive, or to prevent them from even acquiring HIV. So very exciting.
And I would think throughout this process, besides the actual treatment, it's important to engage in knowledge sharing. And how does that impact new research and new practices coming along the way?
That's a great question. So I think part of what that means is making sure you have all the players at the table, if that makes sense. So it's making sure you not just have the communities that are impacted, because you have to lead by community, and making sure you engage them and what are the challenges, but then researchers at different levels. So clinical research, implementation science research, basic science research, and having the conversations be collective conversations to then figure out how to best move therapies forward, but also what therapies are most needed directed by community.
Valuable research. Thank you so much for joining us.
No, thank you. Thank you very much.
In the decades since HIV's discovery, we've made massive strides in our understanding of the disease. We're getting closer than ever to a cure. And at Emory University, they are leading a collaboration that aims to cure HIV once and for all.
The main goals of the Erase HIV collaboratory is to find a cure for HIV, and it includes 15 different institutions. Many of these academic institutions, but also an industry partner, Merck, and a community partner. And we have a very active collaboration. We put together a team of experts in the different key questions that we are trying to address, going from basic immunology to virology to translational intervention. One thing very important of Erase HIV and of these Martin Delany collaboratories is that we have a community partner. So what we do, we try to start from the beginning, even before we design the study, to talk with our community partner, to talk with people with HIV, and be sure that whatever is the intervention we're going to test in the preclinical model will be acceptable if it's effective from people living with HIV.
Now, we all know that IDWeek is an incredible place to learn and network, but what's the best way to stay informed and make new connections in between annual meetings? Well, it's simple, really. You just get on TikTok.
I began making videos around, TikTok and really growing my social media following, I would say right when the pandemic started, and that's when I had a lot more time, quarantine happened, and so we kind of hunkered down, and that's sort of where it started. I started social media, I saw other people doing it, and so I figured, why can't I do it? So I tried it out, and I ended up falling in love with it. I love creating videos, and it's just a really good outlet to, explore that creative side that, you might have. Students who are interested in healthcare field, I would say that is definitely a big demographic that makes up my following. Pharmacy students, medical students. I would say definitely targeting the misconceptions working in pharmacy is probably one of the biggest goals, and I would say objective that I have when I create my videos and why I'm on social media in general. A lot of people don't know what pharmacists do, or they think we're working behind a counter or working in a retail setting. And so I think by showcasing what pharmacists can do, especially ID pharmacists, is really interesting and might be able to, inspire that younger generation. A lot of younger students come up to me and they say, I had no idea you can do that as a pharmacist. I didn't know you could work in a hospital, and I didn't know you could round with the medical team and prescribe under certain regulations and collaborative practice agreements. And so just sort of expanding that and pushing that out to others really will help kind of expand the profession, I think, and advocate for the pharmacy profession, but also just in general for the healthcare field too, and get others inspired. I would say if you are interested in growing and building a brand on social media, I would say first things first is don't be afraid. Get out of your comfort zone. I know I kind of felt a little bit embarrassed and shy when I first started, but the opportunity it's amazing. And the windows that it has opened for me in terms of networking and job growth is just unbelievable. And I would do it again in a heartbeat. So, I mean, first things first, if you're a student, a healthcare professional, whatever it may be, get out of your comfort zone and try to reach out, see small creators and see what they're doing. And don't be afraid to be inquisitive and ask questions. And, it will really grow your career and help you develop into, a better professional at the end of the day. Overall, I think it's a really great opportunity to help grow yourself professionally and also network with others and build, lifelong relationships with others.
ID researchers have developed so many amazing treatments for HIV, but there can be a disconnect when it comes to getting these treatments to patients in the face of barriers caused by stigma and access to health insurance. The McManus Research Group at UVA is working with NASTAD to ensure care for all HIV patients.
When I was a resident in an HIV clinic, I realized how difficult it was to get these amazing HIV medications into my patients' hands. These challenges have inspired our group's entire body of work. We're really excited to have this NIH-supported study, and it is innovative to have partners from different state health departments all around the United States.
ADAPs can and do provide free medications for low-income people who don't have insurance, and that's incredibly important. That's life-saving.
So we're using both qualitative and quantitative data elements to tell a really complex story.
There will be over 100,000 people with HIV in the data set over 10 years.
This research should allow ADAPs to learn from one another in the end.
We believe it's going to identify best practices that are associated with some of the best possible public and population health outcomes among people living with HIV.
ID Week is bustling with bright minds and novel ideas. To find out what's hot right now in ID, we're asking attendees how they stay on top of the latest in their field and what excites them about the future.
I try to stay connected with my colleagues. I learn a lot from my physician friends, from my pharmacist friends. I learn a lot from my network, really.
Accessing the IDSA website, going through current topics on there.
To stay top, I have to answer the right question. To answer the right question, I need to closely work with clinicians.
Mostly through a lot of reading, case reports, things like that, and then also coming to conferences like this to see presentations about the latest science.
Looking forward to learning about some HIV breakthroughs from Dr. Paul Sachs. Looking for travel medicine information.
There's a lot of interesting talks I've seen about climate change and emerging global diseases in that field that I'm really interested in hearing later on in the week.
All the new medications that we have coming out within HIV, we have new medications coming down the pipeline that we would have never dreamed about before for our patients.
If there are some new development to treat antibiotic resistance, I think there's a bit more chance to integrate data into this decision processes, and maybe I can be part of it.
When it comes to HIV, patients often need more than just disease treatment. At the University of Florida, they provide comprehensive care that includes dietary and mental health services.
Well, UF Cares is the only one-stop shop comprehensive program serving all ages, all genders, of HIV infected and HIV affected population in North Florida.
We serve about 1,200 adults annually and anywhere between 400 to 500 children, adolescents. We also have dietitians that are working with our patients. Then we have a pharmacy that's on site. And then we also have outreach services, and we do provide mental health services to those patients that are in need of counseling.
So research has been a critical part of what we do at UF Cares. We are funded through the National Institutes of Health, many pharmaceutical industry studies that we've done here. We also do our own investigator-initiated studies and multitude of other funding sources we have for doing these studies.
Following the COVID-19 pandemic, the number of counties in the U.S. conducting wastewater surveillance absolutely exploded, but its usefulness extends far beyond just monitoring COVID-19.
Since COVID started in 2020, that's when we really started getting going with wastewater surveillance. And it's really blossomed in the last 4 years. Not only have the number of sites expanded in California, we were only monitoring at 6 sites back in 2020. And now the CDC's National Wastewater Surveillance System has expanded to over 1,500 sites and has a presence in 50 states and jurisdictions. So it's really grown, not just in terms of monitoring COVID and its variants through wastewater, but now for other routine diseases. So influenza, RSV, and other respiratory viruses are now commonly being measured in wastewater and surveyed. And then we can also use it for things like emerging diseases, so things like Mpox or now the H5N1 outbreak. And it's been used for things like polio and for other rare diseases that we don't necessarily have good surveillance for, like EBD68. And so because we're able to see it in wastewater, that can really help give us some insight into what's circulating in the community. Antimicrobial resistance is a really important area that we're all really interested in. This is an area of active research in wastewater surveillance. There's a lot of different groups that are out there monitoring for things like Candida auris and other emerging infections and looking for antimicrobial resistance genes in wastewater surveillance with the hopes that that information can be really directly useful at the hospital or nursing home or other kind of infection prevention settings. Wastewater surveillance has been really useful and it's really evolved in the last couple of years, and it's still growing. I think there's a lot of room to add new pathogens and think about novel ways to use the tool. But it's also something that's available now. We have the tools, we have most of this data is available publicly on different dashboards. And I think that's something that we as ID physicians really should be able to use and start to think about and try to incorporate into our clinical practice, as well as thinking about how we're using it at the hospital preparedness level.
Before we close out today's show, we'll learn about one more organization leading the way in HIV research and care. Let's go to the University of Rochester, where they are on a mission to provide top-notch care for HIV, meningitis, and more in rural Uganda.
When I came to the University of Rochester in 2022, I began to focus on developing a program in rural northern Uganda, largely because there's a greater need for research and building capacity for healthcare in rural areas.
The research that I'm doing here at LIRA through the University of Rochester is I am a part of a meningitis project that is looking at all types of meningitis and enrolling participants who meet our criteria. We are helping provide diagnostics as well as treatments and doing follow-up with these patients so that we can see how to improve meningitis care here.
We're trying to be a model for how healthcare can be provided in rural areas. And we hope that what we learn in northern Uganda can be applied throughout sub-Saharan Africa.
That is all for our first episode of IDWeek TV. We've covered so much amazing research and so many fascinating ideas. If you like what you saw, you can revisit today's content at any time. You can keep watching IDWeek TV on screens around the Los Angeles Convention Center, in your room at select hotels, and on the IDWeek 2024 annual meeting website. You can find all of our episodes, segments, and film series features on the IDWeek TV 2024 YouTube playlist, and find selected segments and bonus content on social media. We will be back tomorrow to dive deep into how climate change will impact infectious diseases around the globe. I am Melissa McCarty, and I'll see you then.